Most people believe that heart attacks and sudden death happen during extreme moments like intense exercise, emotional shock, or physical struggle. But medical reality paints a far more unsettling picture. A large number of fatal heart events actually occur when the body is supposed to be safest during sleep, at night. When a person is lying still, muscles relaxed, eyes closed, the heart should be under the least amount of strain. Yet for many people it becomes the most dangerous time of all. This is because sleep lowers awareness while the heart continues working silently in the background, responding to hidden stresses that the person never feels. Blood pressure naturally dips during sleep, but if the heart or blood vessels are already weakened, even small disturbances can tip the balance. The body cannot call for help if something goes wrong because consciousness is switched off, and that is what makes nighttime cardiac events especially deadly. Studies show the early morning hours are a peak time for heart attacks and strokes due to sudden changes in blood pressure, heart rhythm, and stress hormones as the body prepares to wake. Many people go to bed carrying unresolved stress, heavy digestion, dehydration, or chemical triggers like alcohol and medication, all of which quietly strain the heart for hours. During sleep, the heart depends heavily on stable oxygen levels, smooth blood flow, and calm nervous system signals. Any disruption, such as reduced oxygen from snoring or sleep apnea, thicker blood from dehydration, or electrical instability caused by alcohol, can push the heart into a dangerous rhythm. Unlike daytime heart attacks, nighttime events often lack dramatic pain or obvious warning signs. Instead of sharp chest pain, the body may respond with subtle symptoms like restlessness, sweating, strange dreams, or a sudden drop in oxygen that never wakes the person. This is why families are often shocked in the morning, because there was no cry for help, no phone call, no sign of distress. The heart does not need chaos to fail, it only needs the wrong conditions for long enough. Sleep masks danger by quieting the senses, while the heart continues to respond to internal pressure. For people with high blood pressure, diabetes, obesity, chronic stress, or undiagnosed heart disease, nighttime becomes a vulnerable window rather than a safe one. Even individuals who appear healthy can be at risk because damage builds slowly over years without symptoms. The idea that danger only comes from visible stress leads people to underestimate the power of nighttime habits. Sleep is not passive for the heart. It is an active process that requires balance, oxygen, hydration, and calm hormonal signals. When that balance is disturbed, the heart may face its greatest challenge in silence while the rest of the body sleeps. Many people place their trust in one simple belief that if they feel normal, then their heart must be healthy. But the human body does not work that way. The heart is incredibly skilled at adapting, compensating, and hiding problems for years before anything noticeable appears. Plaque can slowly build inside arteries without pain, blood pressure can rise without symptoms, and heart rhythm disturbances can come and go unnoticed. This creates a dangerous illusion of safety where a person feels fine while serious damage quietly progresses. By the time discomfort or classic warning signs appear, the condition may already be advanced. Feeling okay is not a reliable measure of heart health, especially as the body ages or faces daily stress. The heart often whispers instead of shouting, and most people miss those whispers because they expect dramatic signals. Shortness of breath is blamed on age, fatigue is blamed on work, poor sleep is blamed on stress, and mild chest tightness is dismissed as digestion. These small signs become background noise rather than warnings. The heart continues working under strain while the mind reassures itself that everything is fine. Medical data shows that many people who suffer sudden heart attacks had no previous diagnosis and believed themselves to be healthy. This happens because the arteries can narrow gradually without blocking blood flow completely until one final moment. A small clot, a sudden spike in blood pressure, or a brief disturbance in heart rhythm can be enough to turn a silent condition into a fatal event. The body does not always give a countdown. Modern lifestyles make this problem worse by normalizing exhaustion, poor sleep, and constant stress. When feeling tired or unwell becomes normal, real warning signs get lost. Many people also avoid medical checkups because they fear bad news, assuming that no symptoms means no problem. In reality, regular screenings catch issues long before symptoms appear, when they are still manageable. Another dangerous assumption is that exercise or a slim body guarantees heart safety. While fitness helps, it does not erase genetic risk, chronic stress, smoking history, or dietary damage. Even active individuals can develop hidden heart conditions if recovery, nutrition, and sleep are neglected. The absence of pain does not equal the absence of risk. The heart can tolerate abnormal pressure and reduced blood flow until it suddenly cannot. This is why nighttime heart attacks and strokes are so shocking, because the person felt fine hours earlier. The truth is that feeling fine often reflects adaptation, not health. The body lowers sensitivity to ongoing stress to keep functioning, but this adaptation has limits. When those limits are reached, failure can be sudden and unforgiving. Trusting feelings alone allows damage to grow unnoticed. Real heart safety comes from awareness, prevention, and respect for signals that seem small but persist. Ignoring them because they are mild can be more dangerous than dramatic symptoms, because they invite delay and denial, while the heart continues to carry an invisible burden. When people think of a heart attack, they imagine sudden, crushing chest pain, dramatic collapse, and urgent calls for help, but nighttime heart attacks rarely follow this script. During sleep, the body reacts differently, and the warning signs become subtle, confusing, or completely silent. The nervous system is slowed, pain perception is reduced, and awareness is lowered, which allows dangerous changes to unfold without triggering a strong wake-up response. Instead of sharp pain, the body may experience mild pressure, vague discomfort, or a sense of unease that blends into sleep. The brain may interpret distress as a bad dream rather than a medical emergency. Breathing changes, heart rhythm disturbances, and oxygen drops can occur without fully waking the person. This makes nighttime heart attacks especially lethal because help is not sought in time. Many victims never regain consciousness, and by morning the damage is already done. Another factor is that lying down alters blood flow and chest pressure, which can mask classic symptoms. Acid reflux, gas, or muscle tension can feel similar to heart issues, causing the body to misinterpret danger. Even if a person partially wakes, they may dismiss symptoms as indigestion or anxiety and fall back asleep. During the night, blood pressure and heart rate normally dip, but certain triggers cause sudden spikes. These rapid changes strain already narrowed arteries and can rupture unstable plaque. When this happens during sleep, the body may not generate the intense pain signals typically associated with daytime exertion. Hormones also play a role. In the early morning hours, stress hormones rise naturally to prepare the body to wake. In vulnerable individuals, this surge can trigger heart attacks or strokes without warning. Nighttime heart attacks also tend to involve abnormal heart rhythms, which may cause sudden collapse rather than prolonged pain. Arrhythmias can stop effective blood circulation within seconds, leaving no time for the body to signal distress. People with diabetes, older adults, and those with nerve damage are especially at risk because their pain perception is already reduced. For them, a heart attack may feel like fatigue, sweating, or shortness of breath rather than pain. Sleep apnea further increases danger by repeatedly lowering oxygen levels throughout the night. Each oxygen drop stresses the heart and raises blood pressure, creating a perfect storm for silent cardiac events. Many people wake up with headaches, dry mouth, or exhaustion, unaware that their heart struggled all night. Stroke symptoms during sleep are equally easy to miss. Weakness, confusion, or speech changes may not be noticed until morning, when precious treatment time has passed. This is why doctors emphasize that absence of severe pain does not mean absence of danger. Nighttime attacks are quieter, but often more deadly. They steal time, awareness, and opportunity for survival. The heart does not always warn loudly before it fails, especially when the body is asleep and unprepared to respond. Eating a heavy meal late at night seems harmless to many people, but inside the body it creates a serious burden that the heart is not prepared to handle during sleep. When food enters the stomach, digestion demands a large amount of blood flow to the digestive organs. This forces the heart to pump harder at a time when it should be slowing down and recovering. Lying flat after eating increases pressure inside the chest and abdomen, which can compress blood vessels and interfere with normal heart function. The heart ends up working overtime while the body is supposed to be resting. Fatty, salty, and large meals are especially problematic because they take longer to digest and trigger inflammatory responses. Sodium causes fluid retention, raising blood pressure, while heavy fats thicken the blood temporarily and increase workload on the heart. As digestion continues through the night, the nervous system remains activated instead of relaxing. This interferes with the natural drop in heart rate and blood pressure that protects the heart during sleep. Another dangerous effect of late meals is acid reflux. When stomach contents move upward while lying down, they can irritate the esophagus and stimulate the vagus nerve, which directly influences heart rhythm. In sensitive individuals, this stimulation can cause irregular heartbeats or sudden drops in heart rate. These changes may not wake the person, but can destabilize the heart over several hours. Blood sugar spikes after late meals also play a role. High blood sugar increases inflammation, thickens the blood, and damages blood vessels, all of which raise the risk of clots. Over time, repeated late-night eating trains the body into a cycle where the heart never gets true rest. Instead of nighttime recovery, the heart faces ongoing metabolic stress. This is especially dangerous for people with undiagnosed heart disease, high blood pressure, diabetes, or obesity. Even healthy individuals are not immune if this habit continues for years. The problem is not one single late meal, but the routine of doing it night after night. Each night adds strain, and the damage accumulates silently. Because symptoms rarely appear immediately, people assume the habit is safe. The body adapts, compensates, and hides the stress until one night the heart cannot meet the demand. Many nighttime heart attacks are linked to heavy evening meals combined with other factors like alcohol, dehydration, or poor sleep. These triggers interact and amplify each other. What feels like comfort food becomes a silent test for the heart. Sleep turns into a period of vulnerability rather than recovery. Giving the body time to finish digestion before bed is one of the simplest ways to reduce nighttime cardiac stress. But ignoring this basic need allows strain to build where it is least expected and most dangerous. Alcohol before sleep is often misunderstood as a way to relax the body, but its effect on the heart during the night is far more dangerous than most people realize. In the first hour or two, alcohol may create a feeling of calm and drowsiness, but as the body begins to process it, the nervous system shifts into a stress response. Heart rate increases, blood pressure rises, and the balance of electrolytes that control heart rhythm becomes unstable. These changes happen quietly while a person sleeps, making them especially risky. Alcohol interferes with deep sleep stages, preventing the heart from entering its most restorative phase. Instead of slowing down, the heart faces repeated stimulation throughout the night. One of the most serious risks is alcohol-induced arrhythmia, often called holiday heart syndrome. Even people with no known heart disease can experience sudden, irregular heartbeats after drinking, particularly at night. These irregular rhythms can reduce blood flow to the brain and vital organs and, in severe cases, lead to sudden cardiac death. Alcohol also dehydrates the body, thickening the blood and increasing the likelihood of clot formation. This raises the risk of heart attack and stroke during sleep when circulation is already slower. Another danger is the effect of alcohol on breathing. Alcohol relaxes the muscles of the throat, increasing the chances of snoring and sleep apnea. Each pause in breathing lowers oxygen levels, forcing the heart to pump harder and faster to compensate. These repeated oxygen drops act like stress tests for the heart, happening dozens or even hundreds of times in a single night. Alcohol also interacts dangerously with medications, especially sleep aids, blood pressure drugs, and painkillers. These combinations can suppress breathing, disrupt heart rhythm, or cause sudden drops in blood pressure without warning. The sedating effects may prevent a person from waking up during a dangerous event. Over time, regular nighttime drinking trains the heart to expect stress during sleep. Blood vessels become less flexible, blood pressure stays elevated at night, and inflammation increases. The heart loses its natural nighttime recovery window, making it more vulnerable to sudden failure. Many cases of sudden nighttime death involve alcohol, even when the person did not appear intoxicated. The quantity does not need to be extreme. For some individuals, even moderate amounts can be enough to trigger dangerous changes. Because alcohol is socially accepted and commonly used to unwind, its risks are often dismissed. The body may appear calm on the outside, but internally the heart is working against chemical and physiological pressure. Sleep becomes fragmented, oxygen becomes unstable, and the heart operates without its normal safeguards. Removing alcohol from the hours before bed is one of the most powerful steps a person can take to protect their heart during the most vulnerable time of the day